Psychosurgery is a term that refers to surgical procedures that aim to modify the brain's function in order to treat certain mental disorders. Psychosurgery is also known as neurosurgery for mental disorder or functional neurosurgery. Psychosurgery is usually considered as a last resort treatment when other options, such as medication and psychotherapy, have failed or are not available. The history of psychosurgery dates back to ancient times, when some cultures practiced trepanation, which involved drilling holes in the skull, possibly to treat mental illness or epilepsy. However, the modern era of psychosurgery began in the 1930s when Portuguese neurologist Antonio Egas Moniz developed the first technique of lobotomy, which involved cutting the nerve fibers that connected the frontal lobes of the brain with other regions. Moniz received the Nobel Prize in 1949 for his work, which he claimed could cure conditions such as depression and schizophrenia. However, lobotomy soon became controversial and widely criticized for its lack of scientific evidence, ethical issues, and severe side effects. Some patients who underwent lobotomy were left with permanent brain damage, personality changes, cognitive impairment, or even death. Lobotomy was also abused by some practitioners who used it indiscriminately or for political or social reasons. By the 1950s, lobotomy was largely abandoned in favor of less invasive treatments such as antipsychotic drugs. Today, psychosurgery has evolved to become more precise and less destructive. Modern techniques use advanced imaging and stereotactic methods to target specific areas of the brain that are involved in mental disorders. The most common types of psychosurgery in current or recent use are anterior capsulotomy, cingulotomy, subcaudate tractotomy, and limbic leucotomy. These procedures usually involve destroying or removing tiny bits of tissue by heat, radiofrequency, or laser. The evidence for the use of psychosurgery is mixed and limited. Some studies have shown positive outcomes for patients who have undergone psychosurgery, especially for treatment-resistant conditions such as obsessive-compulsive disorder, OCD, major depression, anxiety disorders, and chronic pain. However, other studies have shown no improvement or even worsening of symptoms after psychosurgery. The quality and quantity of research on psychosurgery is also low compared to other treatments, and the long-term effects and safety of psychosurgery are still unclear. The side effects and risks of psychosurgery are also significant and vary depending on the type and extent of the procedure. Some possible complications include bleeding, infection, nerve damage, seizures, urinary incontinence, headache, delirium, memory loss, personality changes, emotional blunting, apathy, and reduced creativity. Psychosurgery may also have ethical and social implications, such as affecting the patient's autonomy, identity, dignity, and human rights. The pros and cons of psychosurgery are therefore difficult to weigh and depend on each individual case. Psychosurgery may offer hope and relief for some patients who have not responded to other treatments and who suffer from severe and debilitating mental disorders. However, psychosurgery may also pose serious risks and harms for some patients who may not benefit from it or who may experience negative consequences. Psychosurgery should be carefully considered and discussed with a qualified medical professional before making any decision. In conclusion, psychosurgery is a controversial treatment for mental disorders that involves modifying the brain's function by surgical means. Psychosurgery has a long and complex history that reflects the evolution of psychiatric science and society. Psychosurgery has both potential benefits and drawbacks for patients who suffer from mental disorders that are resistant to other treatments. Psychosurgery should be used with caution and only after thorough evaluation and informed consent. Psychosurgery is not very common today, as it is usually considered as a last resort treatment when other options, such as medication and psychotherapy, have failed or are not available. According to one source, psychosurgery is only used in extreme cases and the techniques used today are radically different than those used in the past. Another source states that the use of psychosurgery began to decline from the 1950s onward, first in the Soviet Union and Europe. A third source estimates that about 100 to 200 psychosurgical procedures are performed annually in the United States, mostly for severe obsessive-compulsive disorder, OCD. However, the exact prevalence of psychosurgery is difficult to determine, as there is no standardized reporting system or registry for this type of surgery.